Good afternoon. Welcome to the daily briefing at the County EMA office. We're coming to you once again with some more numbers on the increase. We're here with County Board Chairman Mark Kern and, of course, Sam Bierman from the Health Department. Sam, welcome back.
Thank you.
More news.
More news. More increase in numbers. Today, as we have done in the past, all of the numbers that we give you will be St. Clair County residents that have been tested. And as of today, we are at 743 that have been tested. 115 that are positive, which is an increase of 10 from yesterday. And the breakdown for those are a male in his 90s, 2 males in their 80s, 2 males in their 60s, a male in his 50s, a male in his 40s, a female in her 80s, a female in her 50s, and a female in her 30s. We are now at 501 negative test results with 127 results still pending. And as we did yesterday, again, we have some sad news. We have now 8 deaths, which is an increase of 2 from yesterday. The first, a male in his 60s with unknown medical history, and the second, a male in his 90s who did have underlying health conditions. For state totals, we are at 80,857 that have been tested. We are at 16,422 that are positive, which is an increase of 1,344 since yesterday. And we are at 528 deaths, which is an increase of 66 from yesterday. And as always, our thoughts and prayers go out to the families who have lost loved ones and to the healthcare workers that have taken care of those patients. A few things I would like to talk about before I turn it over to Chairman Kern today is, as many of you have seen before, there are different ways that you can make masks, and these instructions, we will post those on the EMA page after the briefing today. But there's a few things when you wear a cloth mask that the CDC recommends that you do. The mask should fit snugly against your face, but be comfortable. Be secured with either a tie that goes behind your head or ear loops. Include multiple layers of fabric. It should allow for easy breathing with no constriction, and should be able to be laundered so you can keep it clean. And again, these will be posted afterwards, but the CDC has even broken it down into using regular cloth and a quick guide to using a t-shirt or bandana for a mask. So that's great that they're making that information available. And for those of you that are wearing PPE out in public, whether you're going to the grocery store or going to the pharmacy, we would ask that you dispose of that PPE properly when you get to where you're going or when you're getting home. Please don't take off the gloves or the mask and just toss them on the ground. Please make sure that you're throwing them away in the proper trash can, proper receptacle. We don't want anybody to have to clean up those used gowns and used masks off the ground, and if they don't have the protection to do so. So it's best if we can just throw them away where they belong right off the bat. So I will turn it over now to Chairman Kern for his update.
Thank you, Sam. So today, with Sam's increase in numbers, the zip codes have also increased, or the numbers in the zip codes have increased. The first zip code, 62206, has 10. 62208 now has 12. 62220 has 7. 62221 has 16. 62223 has 14, 62226 has 18 COVID positives, 62258 has 7, and 62269 has 16. And of course, those numbers are the COVID positives in those zip codes. As our stress levels grow, and they continue to grow, let's all remember to be kind to each other. You know, these are times when our nerves are all balled up. And it's time to remember that it's when people are going to count on us the most, and they're counting on a kind word. They're counting on someone maybe checking on them. If you're going to the grocery store and you know that you have an elderly neighbor that may not want to get out, call them, ask them, can I pick something up for you? Your neighbors and your family and your friends become increasingly important during times like these. So we want to make sure we remember them and just be kind during times like this. So today we're joined by Melissa Hegan. Melissa Hegan is a Memorial Hospital ER nurse and an RN. Melissa, thank you for coming here today.
For having me.
So Melissa, let's talk a little bit. Can you tell us about the loads in the ER right now? how are the personnel holding up? How are the nurses and the doctors and all the staff, the cleaning staff, how are they holding up during all this?
You know, I think that we've come together even more of a team now than we ever were before. We see our EVS people working so hard to keep the rooms clean. As doctors and nurses, and our techs, everybody's working very hard. We don't have the volume of patients that we did. People are starting to stay at home, but the patients that are coming in are much more sick and take quite a bit of our time to take care of. And since they can't have their family members there with them, we try to give them even more compassionate care so that they don't feel like they're so alone.
So how is that? So you have a patient comes in and they are experiencing severe COVID-19 symptoms and they can't have their family there. That has to be a difficult time for you and of course for them.
You know, it is. It's gut-wrenching for us because we know we all have families ourselves and we have grandparents, and we know the importance of people when they come in that sick to be able to have their families there with them, whether they're there and they're just very ill or they're there and we know that they're on the brink of possibly dying and really needing that family with them to hold their hand. So it really tears at our heart to not be able to allow the family back there, but with trying to stop the spread of this virus, we have to, you know, take extreme measures to be able to keep everybody safe.
Is there anything a family can do to stay in contact? I guess if a person is really sick, you know, they're not going to be able to respond to a cell phone or a FaceTime. But are patients that maybe are a little better off, are they able to FaceTime and stay connected with their loved ones that way?
Absolutely, absolutely. So once it came down of the new procedures as far as not allowing the family members in to keep everybody safe, we then were told that we could go ahead and make sure that the families were able to FaceTime them, call them. We make sure when families do call up to get updates that with the patient's authorization, of course, to give information, we're making sure to keep the families as updated as we possibly can so they don't feel like they're so on the outside with it.
So talk to me, I know you have a family. What kind of precautions are you taking in your private life to make sure that when you put your life on the line every day, that you aren't carrying those germs home, or at least that you're trying to stop that spread?
So that's one of the scariest things for a lot of us nurses, techs, doctors, EVS, you know, the whole team that's working together. The unknown of the COVID virus itself can get us a little bit on edge and worried, but I think our worst fear is bringing this back to our children and our spouses. So myself, what I do, I have my own little routine that I do in the mornings when I get off work. I pull straight into my my garage, and I have my own little doffing area that we would say, where, you know, like in the hospital where we would take off of our PPE. Everything comes off there. All my clothes go into a trash can that none of my family is allowed to touch. And then I put something else on, goes straight into my house and straight into the shower. It's really changed how things are at my house because I can't embrace my family and give them a hug or say hello to them until I've showered. But it's what I have to do to try and keep them safe and make sure nothing's being brought home.
And you've even gone so far as to segregate your car so that
I have.
So your car is your car, no one else uses it, and when the family needs a vehicle, they use your husband's.
My husband and my son are not allowed to go into my vehicle to get anything. They're not allowed to go over to my doffing area, so to speak, in my garage. And even like if we go anywhere, run to the grocery store or anything, we have to take my husband's truck. Because I don't know how long the virus is in there. And right now I'm working, you know, some of us are working 4 or 5 days a week trying to make sure that there's plenty of staff. And so I don't know if I have 2 days off, is it gone and out of my car? And I don't want to take the risk of my family getting in there and getting sick.
And if you don't know and you're an expert, what I guess we're trying to get across to the public is this is a highly contagious virus. It is a nasty virus, and so anything you can do to make sure that you are distancing your family from the spread, and I'm talking about to the public, is something you're going to these extra steps. They should do the same thing.
Absolutely.
In their own private world. So you're a floor manager many times at the hospital with the
Charge nurse sometimes,
charge
yes.
nurse. Okay, There we go. It's that's my lack of a medical background. I missed that day in medical school. But can you talk about calls that come into the ER? So people are told call your healthcare provider if you have symptoms. You get calls from mothers, I assume, that have children with fevers. Can you describe that and what the advice is?
We do. We get a lot of phone calls, and everybody's scared. We're scared. The public is scared. It's just, the unknown of it all. And so a lot of times we'll get phone calls that come in saying, my child has a fever. Do I need to bring them in? Do they need to be tested for COVID? And so, we ask them, have you given any Tylenol or Motrin? Or even we'll have adults the same way calling in. What kind of symptoms are you having? We give them the COVID hotlines that we have. We give the phone numbers to the health department if they need to do that in the morning. We suggest to them to call their primary care physician. Now, of course, if they would, let us know that, I'm so short of breath, I can't even walk to the bathroom, I can barely sit up. If they sound that sick on the phone, of course, we're going to suggest, you may need to call 911 or get in to be seen right away. We explain to them what some of the symptoms are. We explain to them what their options are. We can't really give them too much medical advice on the phone because, of course, we can't see them. But we help to kind of ease their mind and, in a way, over the phone triage to a point to see if it is something that needs to come in right away.
Melissa, we sure appreciate that advice. Herb Simmons, do you have anything?
Yes. Are you seeing more of those type of calls come in than normally with this virus going on?
I think at first we did, just because everything was so new, and with all the COVID hotlines and people knowing that they can call the health department and there's hotlines with that, it seems that the phone calls have slowed down. We're happy to answer their questions. We understand that they're scared. We're not going to be frustrated or irritated with them calling in.
Okay. You've been a nurse for 10 years, roughly?
About 7 years. I worked at
7 years.
Memorial for 10.
In your wildest days, did you ever think that you would envision what we're going through right now?
I did not. I definitely did not.
Did not. And the last thing, working the floor, working in the ED department, the nurses become a family. That's your family away from your family. And I'm sure there's times when they get overwhelmed with this is going on and you have that breakdown moment. Is there enough support there for a person who maybe is going through a meltdown?
There absolutely is. There absolutely is. We joke in the ER that we're the best dysfunctional family there is. We all are in similar situations with having to be away from our families and the things that we see in the ER that we become very close. And as tough as we got to try and be with taking care of the patients we take care of, there are always going to be those moments where you just need to let go and be human. And so Memorial really has set aside different things for us, call-in numbers, little quiet rooms, whatever we need. And, all you'd have to do is grab another nurse or a tech or even the EVS workers, our environmental services workers, because we are such a tight-knit family that if you just needed somebody to let loose and cry to, they're there for you, and then you can walk away 5 minutes later and be right back to work.
So, and I know you've heard this and our viewers hear it, but I like for them to hear from you. What is the best advice you can give our viewers out there to help us get through this pandemic?
Stay home. Just stay home, and good hand hygiene at home. Even staying home does not mean having a big barbecue at home and having everybody over. Just stay home and reconnect with your kids and reconnect with your spouse and, try and find something good that can come out of all this.
Well, I'm sure if they follow that advice, we will come through this. And we really appreciate you coming in today. I know you've got a busy schedule, and we really appreciate that.
Oh, you're welcome. Thank you for
Melissa
having me.
Hegan, thank you very much. And our best to the ER department, and
Thank you.
be sure to thank them.
Absolutely, I will.
Thank you. So, you know, we've heard about the front line and our heroes in the ER department. A group that's made a big difference in our world are our elected officials that have helped us to bring the number of PPEs to St. Clair County that we've needed to be able to take care of our first responders and of our medical agencies. And today we're joined by Latoya Greenwood. Latoya is a state representative from the state of Illinois and represents a big part of St. Clair County. And Latoya is here today to give us a little update on what's going on with the state. Latoya, how have you been? Okay?
I've been fine. Thank you, Chairman. Thank you, Mr. Simmons, for having me on today. And thank you for your leadership and partnership during this difficult time. As you know, the governor and his administration, but the governor in specifically has his daily briefing every day at 2:30, which gives us an update on how we're doing as a state and what the next steps as a state for us to adhere to and to follow through as to what our next steps should be. He has been consistent in his communication in delivering a message to all of Illinois about sheltering in, washing your hands, social distancing, as well as Dr. Ezike with the Department of Public Health. So I think in total, they've been able to provide us with a great deal of information and resources that all of us could use.
So, Representative, from watching the governor's briefings and hearing national news and even looking at our numbers, we're seeing that disproportionately African Americans and our Hispanic community are impacted in a greater way by COVID-19. I know you're working hard to try to help with the testing, and actually perhaps may be able to add a testing site in your district?
Correct. So myself, along with Senator Belt, have been working extremely hard on getting a testing site in East St. Louis due to the fact of this disease or this virus has affected Black people in an alarming rate. And so we felt it necessary to have a testing site in East St. Louis and for the surrounding communities there.
And I think that's important. Testing, from everything we hear, is a way to help solve this virus. We also see from the sheriff's reports that we've had a number of parties everywhere from Jones Park to 17th and Piggott Avenue and on Market and on 31st Street, where people are gathering. And they've got to realize that gathering is the worst thing you can do. Is that right?
Absolutely, it is. And so we will be partnering with the Mayor Eastern of the city of East St. Louis, in doing maybe PSAs to let our community know, the people know, that how important social distancing is, how important staying at home is during this critical time, and continue to wash your hands with soap frequently also. So we look forward to maybe rolling that out over the weekend to let people know to stay at home.
What services is the state, I didn't mean to cut you off.
And like you said, that doesn't mean barbecues at home. I think our nurse spoke to that earlier. Barbecues or big events at your home, it means to shelter in and practice social distancing.
We'll be able to have those a little later.
A little later, yes, absolutely.
Can you address any mental health programs that are available or issue that? I know that's an issue that's important to you.
Yes, so of the calls that I'm receiving at my district office, it includes support for unemployment claims, which has skyrocketed through our state and in the country in general, and for mental health resources, as well as domestic violence abuse claims have risen. And so I wanted to provide your audience with information on those things. So if you have a claim, an unemployment claim, you can contact the Illinois Department of Employment Services. And they can visit www.illinois.gov/IDES, or they can call 1-800-244-5631, and they should be able to get all their questions answered regarding how to file a claim and that whole process. And as far as the mental health resources, the Department of Human Services website has an enormous amount of information, and most of this information can be found at coronavirus.illinois.gov, which is like a main portal of information that is poured into from the state. But individually, the departments, you can visit their websites. Locally, we have great community partners like Call for Help, who are doing amazing work in mental health resources as well as domestic violence. Also, the Comprehensive Behavioral Health Center can be contacted as well. So,
And these are all agencies that rely on state funding.
yes.
And
yes.
you have been front and center at the legislature when it comes to making sure these agencies are funded, and we appreciate that. You also have a very active district office, and people can still contact your district office if there is a need that perhaps they haven't been able to fulfill?
Yes, absolutely. So my district offices are closed, but we're operating virtually. So you can still contact me at my email, staterepgreenwood@gmail.com, or you can still contact my office. We're checking voicemails at 618-646-9557.
That's great.
And I have a lot of information posted on my Facebook page at State Rep Greenwood on Facebook.
Thank you. Herb Simmons?
Representative, thank you very much for coming in. I personally want to echo the chairman's comments. You have been there every time we've called the phone. You're on our conference calls, and when we've needed those PPEs for our first responders, I know you've been pushing those buttons. And just to throw it out there, we put another order in today. So if you'll push that button a little bit harder, we gave out another 31 departments of supplies today. So we're starting to run low again. So I thought while you were here, captive audience, the squeaky wheel gets the most oil is what my grandmother used to tell me. But I really want to thank you for what you've done and what you represented. Same way with the governor. I mean, I like what the governor says. He's leaving, and all of his decisions are up to the scientists and the experts. And I think that's what we're all trying to do, is follow their lead. And I think it's going to pay off in the long run. Even though our numbers are still going up, we're gonna get there. But thank you for what you all do.
Thank you.
Okay. On the EMA side today, more conference calls. It seems like every day we're adding more in them, but it's for the cause. The 8 o'clock call with the hospitals and EMS agencies, a lot of more good information we're networking there on. Had our regional EMA conference call. That's where we put our order in for some more of the PPEs to get to us. I wanted to mention to you the 911 calls. We're getting, those are increasing more on gatherings. I've instructed the PSAPs to take those calls and give them out to those local departments, because if you aren't going to willingly take our suggestions and stay away from those gatherings, Sheriff Watson and all the local municipalities today, Muscuda put out a public service announcement. The mayor, I want to thank him, the police chief out there. Every community throughout the county is echoing the same thing we've been telling you now for over a month, and that's to stay home. And the police chiefs and all of them are on board saying that if you are out gathering, you're going to get a visit from them. And they may warn you the first time. After that, they may take drastic steps because this is drastic times. As I told you yesterday, it's real simple. And then we're going to get off of here so the ladies can come in and translate this to our Spanish communities. And it's real simple. Just stay home and stay alive. We'll see you tomorrow around 3:30 with another update. Thank you.